Hi, my name's Felicity. I'm one of the coaches at ACHS. Lisa has asked me if I could spend a few minutes having a chat to you about delivering guiding meditation to people that may be living with chronic pain or chronic illness or even terminal illness. As well as being a coach at ACHS, I'm also a registered nurse. My specialty is breast care nursing. So I look after women who have had surgery for breast cancer. I also co-facilitate 2 support groups for women who are living with cancer, and included in that are women living with secondary cancers. I've been blessed enough to guide these women in many meditations. And throughout that time, I've been able to have some very candid conversations with these women. So have the opportunity now to pass on some of that information to you. Firstly, one of the considerations we need to have with participants that may be in pain, chronic illness, or have a terminal illness, of course, is their comfort. So it's important that we provide chairs for those people that are unable to lie down or sit down on the floor. So a beautiful, comfortable chair with pillows and blankets is important. For those people that still would like to get down onto the floor, it's important that you assess them properly before this happens to make sure that they are actually able to get back up off the floor again once your meditation has finished. So once you have ascertained that they are able to get back up again, the considerations are that if they're lying on the floor, they may need more than just one cushion under their head. They may need cushions all around them to maintain their comfort levels. They may possibly would rather lie on their side, curled up. Often my participants are in the fetal position, having cushion between knees, behind their backs, hugging cushions, and of course under their head. Once your meditation has finished, it's about getting them up. Things that can help them do that would to be have a chair in front of them with the seat part of the chair facing them. Allow them to get up onto their knees, and then using their arms leaning on that chair to lever themselves back up again. And please, being aware of your own safety for your own physical body, and that you don't injure yourself either. Some people may need assistance, not only from you, but perhaps from somebody else as well. And like I said, assessment prior to getting on the floor is a very wise idea. The second consideration is to do with the language that we use in meditation. Firstly, I find, we already talk in the course about not using the word healed, as we can't presume that anyone is going to be healed, and that if we talk about being healed and then somebody isn't, then we, take them into thinking that they've failed, or, possibly they can accuse you of, saying that they're going to be healed and they haven't been. So we use the word healing quite often, for instance, allowing your body to be infused with this beautiful white healing light, which is such a beautiful thing to do. But for these women, I found that it actually takes them back into their minds once again. We all know that miracles can happen, but for the main part, these women believe that they are going to die from their illness, and that healing is impossible for them. So by mentioning the word healing within the meditation, takes them back into their mindset about their cancer, and often they're coming to meditation to get away from that. So we're actually taking them back into their mind and their thoughts again about their cancer and whether their cancer can be healed or not. I'm fully aware that meditation is way more than just relaxation, and that it's not an escape. But what I have found with these women in particular is that that's exactly what meditation is for them. It is an escape from the 24/7 daily life that they live with their cancer, relating to doctor's appointments, hospital appointments, scans, tests. It's all about their cancer. They become their cancer. And so meditation for them, even if it's just for 30 minutes, is a step away from that, to cease that mind chatter, and it becomes an escape for them. It becomes time to relax and time to escape their life living with cancer. So the last thing that we want to do is to bring them back into that. The other consideration is to be aware of what illnesses that your participants may have. Because if I'm guiding a meditation for someone, for example, who has lung cancer, and I use a breathing technique where I'm constantly referring to lungs, then that is going to just take them into their lungs and right into their mind again about their cancer. So believe me, it is possible to guide people through breathing techniques without mentioning their lungs. And also then referral to other body parts, like chest for women that have breast cancer, pelvis for people that have bowel cancer. Just so being aware of where their illness or their cancer or their pain may be. Talking about bones when people have their bone cancer. So we've learnt in session 2 about referral to just very generalised parts of our body, like our face and our belly and our feet and our shoulders. So we can just go through using generalised rather than specific body parts like that when we're going through the relaxation state and guiding meditation. One of the other considerations is to use different techniques, like I know that my women absolutely love the sound meditation. The sound is a brilliant way of actually taking them out of their heads. It's a great distraction away from their thoughts, and for them I can just play my bowls and gong and for like 20 or 30 minutes sometimes, and they just love that very much. The other consideration then, mentioning time, is the amount of time that they are able to lie in the one position as well. So often, as with the anxious participant, the meditations may not be as long. So a chat with these people before delivering the meditation is a great idea as well. Asking them, how long are you able to lie still for? And also being aware that they may move throughout the meditation as well. So talking about and guiding people to be still throughout their meditation is probably not a brilliant idea either. Because you don't want them to be lying there thinking, oh my goodness, I've been told I've got to lie still and I'm in pain, and then that takes them back into their heads again as well. So giving them that allowance and that permission, if you like, that they may move throughout the meditation if that's something that will make them and allow them to be more comfortable. I hope that a little bit of this information has helped you, and that those of you that are completing your course, so that of course you're enjoying every minute of it. I know, because I have completed this course as well. So hopefully I've helped you a little bit here, and enjoy the rest of your day. Bye bye.